Insulin also feeds into cancer. If there's activity or the cell's not working properly, we can increase cancer growth with high insulin. And if you have high insulin and high glucose, that really increases your chance of cancer and lots of other chronic conditions like Alzheimer's disease, even mental health conditions, depression, anxiety, schizophrenia, bipolar, all those conditions as well.
Dr. Avi Charlton, welcome to the podcast.
Hi, Paul. Thanks for having me.
It's an absolute pleasure. Thank you for returning the favor and coming onto my podcast after I was on yours. What conference was it that we met at? Can you remember?
It was actually, no, it was just LinkedIn. I was sending messages to many people to try and connect to many people. And you messaged me back and saying, let's have a podcast exchange. And I was so delighted that we did that. And you came on my podcast maybe 6 weeks or 7 weeks ago.
Yeah, cool. Now, so your background, you've been a GP for 20 years. We are going to talk about diabetes, metabolic syndrome, diet, maybe a little bit of breath work. But I think first to introduce to people your own journey, because I think this is pretty critical in the approach that you take, right?
Yeah, sure. Absolutely. I have had my kids. My kids are now 12 and 15. So when they were growing up and stopped becoming toddlers, I wanted to lose some weight and gain health. I was a bit chubby, busy doctor. I work almost full time and looking after kids. So I looked at the local gym and joined the gym. And I wanted to get fit. After a few weeks, nothing worked. A patient came in to see me in a normal consultation and looked at me and noticed I was a bit chubby and asked me if I was having another baby. Actually, I wasn't.
Oh, wow.
So to my devastation, I worked harder at the gym and then I joined an 8-week body transformation challenge at the local gym just to have fun and see what it's like. And the personal trainer actually prescribed me a diet on a spreadsheet, measuring the amount of protein, amount of carbs and fat. And that was actually a low carb diet. I lost 4% body fat and 4 kilo in weight. And I'm a small petite Chinese, which 4
yes,
kilo.
So that's significant, right?
Yes,
particularly
yes.
in 8 weeks.
Absolutely, yes. My mother is actually a type 2 diabetic, so I've got a family history of type 2 diabetes, even though we're small and petite, and she's not overweight either. So I was very pleased at the low-carb diet and getting into ketosis that helped me lose weight, and I gained some muscles on the body scan as well. I learned a bit more from many places, Low Carb Down Under and Nutrition Network, and I learned how to prescribe low-carb nutrition, the science behind it, and therapeutic carbohydrate restriction as a therapy to patients to help people lose weight, gain health, and actually works on lots of medical conditions as well. So I keep learning, and there was COVID and clinic was quiet, lots of online courses, connected with many like-minded low-carb colleagues. And it opened me up to an amazing journey on how to prescribe low-carb, how to do it effectively, and the science behind it. And 2 years ago, I branded myself to start up this low carb clinic called Melbourne Low Carb Clinic. And again, it opened me up even more to more people connected to the space. And people seek me out to learn how to do low carb. And some people look at me to look at blood tests differently than a normal doctor. Yeah, so been amazing so far, and I'm going to keep going with this journey.
Were you concerned at any stage because of what happened to Gary Freckah, Dr. Gary Freckah? So just for the listeners who will probably not be aware of this, he was a Tasmanian doctor. Now I'm going from memory, so you can jump in at any stage. But he was prescribing a low carb diet. I'm not sure if it was low carb just purely low carb
Yes.
or low carb, high fat, but it was certainly a low carb diet
Mhm.
to his patients with diabetes and getting success. But then he got reported by somebody, and I'm pretty sure he got struck off or suspended by the Australian APRA, which is
Yes.
what's
The
the
medical, it's an equivalent to the medical board that
yeah,
governs the doctors.
and basically said that he was working outside of his professional practice. You know, the diabetes people jumped all over this because they had typically prescribed a high carbohydrate but low GI diet, right? And this was the time when all the controversy was going on. And actually, when you look under the weeds of that one, there were kind of dark forces, including big food, who were going after him, right? And he ended up,
Yeah.
I'm pretty sure he got suspended for a while, but then he quite recently got an apology
Mm.
from the Australian Medical Association or whatever the body was. So were you concerned? Where did the timeline, does it cross over whenever you started, or had that kind of all blown over at that stage?
Yeah, yeah. I know the story. I think he did this quite a few years ago, and it was the dietitians in the hospital who reported him because he was
Nice.
advising the patients in the hospital, because he was chopping feet and legs of diabetic patients. He doesn't want to chop feet and toes off anymore. So the dietitians in the hospital reported him, and he did get suspended, but now he's reprimanded. He's fine. He's going okay, and that was way before I started. So I actually listened to his talk in 2019 before I started prescribing low carb, and he was apologized and justified, and he kept advocating low carb even before I started in 2019.
Okay, cool. So that had blown over, so there wasn't
No
any
issues, no.
massive issues. So let's talk about diabetes in general, and I do want to talk about metabolic syndrome because they're obviously pretty closely linked. So just I think we need to be careful here and make sure we make a very clear distinction between type 1 and type 2 diabetes, and then
Yes.
there's gestational diabetes. So talk to us about the difference between those two conditions.
Yeah, sure. Type 1 diabetics are people that their pancreas doesn't work, so they're lacking insulin. Their pancreas doesn't make enough insulin. Quite often in kids, sometimes in adults, it's an autoimmune condition. So these people really need the insulin, and we will give them prescribed insulin. The gestational diabetics are the women who become insulin resistant during their pregnancy. Quite often they've got a tendency to be insulin resistant
Uh,
already, and quite often after the pregnancy they would reverse and become not diabetics anymore, but they've got 50% chance in the rest of their lifetime to become type 2 diabetic, so they've got much higher chance of becoming a diabetic. Whereas type 2 diabetes is basically insulin resistance, so your body is making more and more insulin to put the glucose away, and we can actually test the insulin in your bloodstream and find the high insulin because your body's making so much insulin and not coping, and the blood glucose is high. And the step before type 2 diabetes is metabolic syndrome. So before we recorded, we talked about the statistics of metabolic syndrome is actually really high. To diagnose metabolic syndrome, the main thing is belly fat. So if the patient has high belly fat, quite often there's this metabolic syndrome, which means
and sorry, Avi, I would just jump in because different organizations describe it differently, right? Which gets confusing. But within Australia, and I can't remember, and I know there's different organizations in the States, and then there's a World Health Organization. But in Australia, we use the three or
yes,
more of five. So one, you
that's right.
talked about central obesity, then
Yep,
high blood pressure, high triglycerides, low HDL cholesterol, the in brackets good cholesterol, and high
yes,
fasting glucose. So three.
that's right.
I think the point of it is it's a cluster, isn't it? It's metabolism going wrong generally.
Absolutely. That's right. Yeah, we only need 3 out of those 5 things to diagnose metabolic syndrome. When you have metabolic syndrome, your body isn't functioning properly, your body's not burning fuel properly, which also means the mitochondria, it's not functioning properly.
And hence why we see huge complications with people with metabolic syndrome. Like not only do most of them either have or go on to develop diabetes, but the increased risk of cardiovascular disease, neurodegenerative diseases, some forms of cancer. I mean, chronic kidney disease. The list is pretty endless, isn't it? Your risks.
Absolutely, yes. It's terrible with metabolic syndrome.
And it's basically, I think, like you said, the mitochondria are really not functioning well. So they're the parts of the cell that drive. It's not only energy production, but they actually do so many functions in the cell. I think we've underplayed traditionally the role of the mitochondria and what they do. But the stats, I mean, you nearly, when you quoted to me the American ones, I nearly fell off the chair, right? So in Australia, the official number of Australians with metabolic syndromes is 35%, and it's probably underreported. Just like with diabetes, they reckon there's 1.25 million with type 2 diabetes, but
Yes.
about 500,000 who have it but don't know it, right? And I think there's probably
That's right.
something going on with metabolic syndrome. But tell me the data from the States.
Yes, I always look it up, and in the NHANES study, which is the National Health and Nutrition Study in 2016 in America, 83% of Americans have metabolic syndrome, which means only 17% of Americans are healthy.
Jesus Christ. That is just bonkers. I was looking at this actually, and there's a brilliant website and for our listeners, for this as well, it's called Our World in Data, and it just shows, it is fantastic because they do visualizations of all sorts of data and all sorts of health data from around the world, and they pull in World Health Organization data. And I was just looking at diabetes, right? So in Australia, and they lump it together. I think in Australia, I think there's 5.6% have type 2 diabetes, or 1.25 million. And as we said, a lot undiagnosed. But all diabetes, including type 1, Oz is 6.4%. UK and New Zealand are very similar. USA, 10.7% with diabetes. Mexico, pretty much 17%. Spain is almost as bad as the States, 10.3%. Which I suspect that their eating patterns have got something to do with that. The fact that they eat dinner late at night might have something. But I was actually quite surprised by Spain. Of all the European countries, Spain is just out there. But wow, when you look at Egypt, 20% of the population has got diabetes, and in Pakistan, 30%.
Yes.
That is
That's
just
amazing.
Unbelievable, isn't it? So talk to us about issues and complications that both you will see in private practice and, what does the research tell us? What are some of the issues and what are some of the complications with both diabetes and metabolic syndrome? And you can take those in any order.
Yeah, sure. Let's talk about metabolic syndrome first. So these people, they are not quite diabetic yet, according to the blood test diagnosis. The HbA1c is not over 6.5. But we can diagnose according to the criteria, and quite often I would find high insulin, and quite often they are not well. So their blood test says they're okay, but they're overweight, they're tired, they're hungry, they have signs of metabolic syndrome, like they have belly fat, they have frequent infections, they have skin tags underneath their underarms and in certain areas of the body, and they have dark patches underneath their arms. So there's signs that we can tell that they have metabolic syndrome, and quite often they just don't function properly in their energy level. They're tired and hungry.
And Avi, sorry, just one thing on that, because you said that they're not yet often diabetic. I remember talking to a medical researcher, and she told me that blood glucose is often the last thing to go. So you'll
Yes.
see blood pressure issues, you'll see triglycerides, you'll see belly fat, you'll see mitochondrial issues, and the very last thing is blood sugar. And this gives people, I think, a bit of a safety blanket that is not warranted, because they kind of go, they get their blood test, go, and they go, hey, well, my blood sugar, I'm not diabetic yet, so I'm kind of okay. Whereas they're metabolically, they're already falling apart, aren't they?
Absolutely. What happens is your insulin is making, your body's making more and more insulin to regulate the glucose. So the glucose is regulated and your body's managing okay. Most doctors don't organize the blood test called fasting insulin and don't know what the insulin is doing. So the blood glucose is managing fine under 6. If it's 5.7, 5.8, it's borderline, but the doctor says it's fine under 6. And the HbA1c is the average blood glucose over a 3-month period is still fine because your average glucose is 5.7, 5.8 during the day. So your normal doctor will say you're not diabetes, you're managing fine, your fasting glucose is fine. Whereas I test the fasting insulin, usually we want it ideally under 7 or even under 5. Some people I tested, it's 10 or 15 or even up to 30 or 60. So these people have made their insulin so much to keep their glucose down, and they're just tipping on diabetes.
Okay, and they don't know it, and there's not really the warning signs. So why is it that a lot of GPs don't do the insulin test? Is it because it's kind of non-standard, or are they just not looking in
Yes,
the right place?
that's right. Yeah, we were never taught in medical school to organise these tests. And there's also a trouble that in Australia, if you organise too many blood
To,
tests
yeah,
under Medicare, we get told off, and because of the funding issues.
yes.
So we're very careful on organising only the blood tests that we have been taught to organise and not do too many and get into trouble with Medicare.
And that's an issue, isn't it? Because if somebody is on the face of it not diabetic, but you test their insulin and you can see their insulin's going crazy, and
Yeah,
you know that diabetes is around the corner,
yeah,
it is so much more effective to intervene right there and then, rather than waiting until that number ticks over to diabetes.
absolutely. Yes. So the number that ticking over diabetes is HbA1c 6.5. We actually should start warning people when HbA1c is over 5.7. That is actually a diagnosis of pre-diabetes.
Right.
And there's some low carb, big name professionals like Tim Noakes actually suggest we should really aim HbA1c much lower than that to less than 5.5 or 5.4, which I think it's quite difficult. But just to warn people that HbA1c going over to 6.5, it's quite advanced, and there's damage just done already to
Yeah.
small vessels, complications.
I think this is the thing, Avi, that people don't realize is the damage that is happening underneath the hood to their
Yeah.
metabolism. Like with that constant high insulin, it drives inflammation at a cellular level. As you say, it impacts on your mitochondria in your cells. And
Yes.
you know what? If I was the czar of the universe, I would just make everybody sit down and really understand their mitochondria, understand what they do, the implications in health, and how to have healthy mitochondria. Because once your mitochondria go, you're starting to fall apart at a cellular level, right?
Absolutely. The other thing with high insulin is, as you said, it's highly inflammatory. It gives your body inflammation, so there's aches and pains and frequent infections. And insulin also feeds into cancer. So if there's activity or the cell's not working properly, we can increase cancer growth with high insulin. And if you have high insulin and high glucose, that really increases your chance of cancer and lots of other chronic conditions like Alzheimer's disease, even mental health conditions, depression, anxiety, schizophrenia, bipolar, all those conditions as well.
And why do we think, I want to come back. There's a couple of things I want to double click on
Yeah.
actually. And before we do it, I just want to mention Tim Noakes, because I nearly did a PhD with Tim Noakes. So
Oh, okay. Yeah.
he's a legendary professor from South Africa, like huge in the sports science world,
Yep.
absolutely massive. Wrote
Yep.
the
Yep.
best-selling book ever on exercise or running called The Lure of Running, and
Yes.
done bucket loads of research on high carbohydrate improving sports performance, right? So he's a legend in that field.
Yep.
And I saw him talk at the first low carb conference, and he held up his book, The Lure of
Yeah.
Running. And he said, anybody who's ever read this book, which is the best selling book around exercise ever, I apologize.
Hang
I
on.
got it wrong. I
Yeah.
give many of my athletes diabetes, and I give myself diabetes, and you cannot outrun a bad diet. And I was like, wow. And it's
Yes.
just a little aside for people who do lots of exercise and are taking lots of sports drinks and stuff like that, just to have Tim Noakes's words in your head, you cannot outrun a bad diet, right? So I just wanted to throw that one in there. But I want to double click on two things. The mental health that you talked about, and the
Yes.
Alzheimer's disease.
Yep.
So do we know what is causing the mental health issue that we see with people with metabolic syndrome and type 2 diabetes? Is it mitochondrial? Is there just some pathway that we're not quite sure of yet?
Yeah. The theory we worked on with mental health previously is neurochemicals imbalance,
Yeah,
which there's a lot of science saying that it's might not be the case.
it's bullshit.
And
I'll say it,
yes,
Avi, it's bullshit.
that is mental health condition is actually a combination of inflammation and your brain not getting enough fuel. There's a psychiatrist called Chris Palmer wrote the
Yes.
book Brain Energy, saying most of the mental health conditions like schizophrenia, depression, bipolar, anxiety is because of lack of fuel to the brain, probably causing lack of mitochondria function. So the mitochondria is not functioning properly, combined with inflammation and high glucose levels, maybe not eating enough good foods, maybe not enough exercise, sedentary lifestyle. All those things combined can really increase the risk of mental health conditions.
Yeah, I've read that book by Chris Palmer, and it is absolutely brilliant. He's a Harvard psychiatrist, isn't he?
Yes,
And it's
yes,
basically your mitochondria not functioning well.
that's right. Yeah.
Yeah. And then let's then talk about Alzheimer's disease and dementia in general. I mean, I remember 15 years ago reading a research paper calling Alzheimer's disease type 3 diabetes,
Yes.
right? So talk us through the links there with neurodegenerative diseases, and particularly Alzheimer's.
Yeah. Yeah. What happens is if you have diabetes, you've got much higher chance of having Alzheimer's disease. And as you said, we're now linking Alzheimer's disease as we're calling it type 3 diabetes because the blood isn't getting enough glucose into the brain. What happens is the glucose is difficult to cross the blood-brain barrier, especially in high insulin environments. So your brain is actually not getting enough fuel in terms of the glucose. And that's why your brain is starving and not functioning properly. When we switch these Alzheimer's people into a ketogenic diet, or even just giving them exogenous ketones as
Keto.
fat,
Yeah.
then we can actually fuel the brain in a different way. And they get alternative fuel. They actually feel much better, even if they don't go on a low carb ketogenic diet. Giving them exogenous extra ketones can help the brain function better.
Yeah, and most people don't realize this, that the brain runs brilliantly on ketones, right? It actually is really effective. And I have read papers of people getting dramatic improvement in their symptoms when they go on a ketogenic diet, or as you say, just giving them exogenous ketones so that the brain and the mitochondria, let's be clear on this, the mitochondria going, at last we've got some energy, now we can start to work again, right? let's just, if this isn't depressing enough for people, let's go through just some of the complications that people have with diabetes. Because I find a lot of people who have diabetes, the kind of attitude was, oh, well, I'll just go on the medication and that will manage
Mm,
it. Talk about some of the complications as you get down the track. I mean, you talked about Gary Fecka doing lots of amputations. Talk about what happens to people's visions, why the amputations,
yeah.
other
Yeah.
things that happen.
Yeah. So in medical school, we're taught to think of big vessels and small vessels, macrovascular versus microvascular. So in terms of big vessels, you can get heart attacks, you can get strokes, you can get blockages in your arteries going down to the legs, and then that causes diabetic feet. So lots of big vessels problems, complications with blocked arteries. And then there's small vessels problems, such as blocking the small vessels in the feet and causing gangrene in the feet, losing toes, losing feet or legs as well. And then there's the small vessels in the eyes, going blind. There's small vessels in the kidneys, so people are losing their kidney function and needing kidney dialysis.
Dialysis, yeah.
Yes. So with regards to the eyes, going blind isn't very fun. There's a doctor called James Mukey. He's the Australian of the Year in 2020. He is an ophthalmologist and he learned about low carb and telling his patients that diabetes can be improved, but just by going low carb keto. And he's helped people with gaining their eyesight and doing
I
much less.
I read about him. He was restoring vision in people who were going
Yes.
blind with diabetes, wasn't he?
Yeah,
Unbelievable.
he's doing a lot of work in the low carb space and trying to approach the parliament on increasing the awareness of low carb diets, especially in diabetics. So he was Australian of the Year 2020, which was unfortunate in that year because that was locked down. And he organised a lot of talks around Australia, but he couldn't do it because we blocked ourselves down.
Right. Okay. And that's pretty amazing, right? That
Well,
you can reverse people going blind just by changing their diet. When you look at the data, right? When you put up low carb versus low fat diets in the management of diabetes, low carb consistently comes out on top. And a ketogenic diet can be very, very effective. Why is there still such resistance amongst medical people, both doctors and dietitians? And such resistance. Like I don't think there's anything in medicine that is so emotional as well. What's going on, do you think, here?
yeah, I think there's lots of things going on. There's a big combination of different forces. Some people think low carb means high fat, you're eating lots of saturated fat. And then there's doctors worried that the high fat can increase your cholesterol and clog your arteries. And that's not healthy, it's inflammatory, which is actually low carb ketogenic diet is actually highly inflammatory. So I think there's a worry about the high fat. And then some people worry about the high protein, increasing your risk of kidney disease, which again, that's not true. And then there's people really can't let go of their carbohydrates because it's so yummy and addictive. So the doctors can't let go of their
Yeah.
dietary preferences. They have to eat their carbs, and then they don't want to implement this to the patients, and they say it's not sustainable because they can't sustain it themselves. And then haven't looked into the science into it. And then
Yeah. And
there's
I was just going to throw in the political stuff and the
yes,
people who have their entire careers on it. But I think we do need to recognize, Avi, here, and you brought it up, that there's a difference between a low carbohydrate diet where lots of the nutrients are replaced with protein and stuff with the low carb high fat, and particularly when that is saturated fat. So I think some of the concerns are high amounts of saturated fat can cause fatty liver disease, which can then drive insulin resistance. And it seems to be when you dig into the research that there are genetics involved, like any nutritional study. This is the thing. When people draw conclusions on nutritional studies or any study, when they're talking about the results, That's the average spread across everybody in the study. It's really interesting when you look at research papers that publish not only the averages, but the individual data, because you will often see people doing extremely well and then others not doing well on the same diet or the same intervention. But when you average it out, there's a statistically significant improvement. And that's really important for people to understand, isn't it? Is that there are individual differences that are largely based on your genetic makeup and your epigenome and all of this, right? So I think there's always nuance with the conversation, particularly when we're talking about research.
Yeah, absolutely. And there's a very latest study that came out about low carb nutrition increases the risk of diabetes. It's only in the last week or so that's come out. I don't know if you've heard of
No, I
that
haven't seen it.
study, Paul. It's all over the low carb world, and the low carb world isn't really very happy about this study increasing the risk of diabetes. What happens is they categorize these in this study. It was a big number. It was in Melbourne. It was 17,000 participants over 10 years. They had 5 groups, and the low carb group wasn't actually low carb. Their dietary carbohydrates constituted 38% of their calorie intake, which to the low carb people, it's actually not really low carb. So
That's
most
not
of us,
that's not low carb. Yeah.
no, most of us would eat way less than 38% of our calories. And to top that, this group, which they said is low carb group, actually started off with higher BMI, higher waist circumference.
Right. Jesus
And they
Christ.
also had more ex-smokers, more ex-alcohol drinkers. And they based it on food frequency questionnaires, which is highly unreliable. People don't really remember what they ate. So there's a few doctors in the low carb world, including Dr. Paul Mason, that actually recorded in the Low Carb Down Under YouTube channel. People can go into that. A rebuttal on this study, and we're actually signing a request to withdraw this study from being published because it's not a reliable study and it's scaring people from low carb diets for treatment of diabetes.
Yeah, I know Paul Mason. I presented at him with him at a conference. He's brilliant doctor.
Yes.
As you were saying that, if people could see me, I'm just shaking my head in disgust because there's so many studies that are getting published, particularly in the nutritional realm, that when you look at the methodology, it is terrible. And if I was to try and put a study like that under the noses of my PhD supervisors, they would kick me out. Like it's like some of this stuff, how this is peer reviewed, I got no idea. But that's the important thing, isn't it? Is that these studies get published and then they get grabbed on. There's headlines that are put on. Sometimes those headlines are actually put out by the people who do the study who have a vested interest. Right.
Yes.
And then the press grabs on it and then it's all over the press and then it creates this panic. And then when somebody like Paul Mason or the low carb guys go, well, actually there's this flaw, this flaw, this flaw, this flaw. And then the journal either corrects it or retracts it. You don't see the headlines again going,
right.
Oh, by the way, we were wrong. So you're okay.
Or the other thing that Paul pointed out in this study is they haven't taken into account the use of seed oil, vegetable oils.
Right.
So there's a high percentage of polyunsaturated inflammatory trans fat in those people. They don't regulate it in that study.
That's interesting. Okay, so let's talk about the diet that you recommend for your patients.
Yeah, so I usually meet them where they're at. If they have no idea about low carb at all, I usually just warn them about the dangers of sugar and processed foods. So to start them off, if they're not ready to go low carb, I just get them to get rid of sugar, get rid of processed foods, and even eliminating snacks in between meals, eating less frequent, intermittent fasting that can quite often improve their insulin level. And if they're ready to learn more and dig into a bit more, then I warn them that carbohydrates all become sugar. They are all sugar. and your body can only hold 4 grams of glucose at a time. 4 grams of glucose is 1 teaspoon. So if your bloodstream has more than 1 teaspoon of glucose, then your body will make more insulin to transport this glucose into the fat cell and store it as fat. So every time you eat more than 1 teaspoon, then your body makes more insulin, then you become insulin resistant. So usually I tell them about the science and warn them about the glucose, the sugar, the junk food, processed foods, and the carbohydrates, and ask them to reduce eating all of that and eat more nutrient-dense food like protein, above-ground veggies, especially if they have signs of metabolic syndrome, diabetes. The root veggies also increase glucose level. So concentrate on above-ground veggies, eating much less starchy veggies and even less fruit. Quite often that can improve their glucose level. Their body heals with higher nutrient-dense, protein-rich, healthy fat food. And quite often they gain health, they get more energy, they lose weight. And the men do it much better. The ladies have lots more hormones and worries going on. Usually the women come in and want to lose weight. They put their husband into a low-carb diet without really telling them. Their husband lose weight, and the ladies lose a bit and they feel better, but the husband do much, much better.
And men tend to do better on fasting as well, intermittent fasting as well. You know, it's just bloody easier for men. A couple of things I wanted to double click on. I want to talk about the healthy fats in a second, but I remember Grant Schofield, Professor Grant Schofield.
Yes.
You will be aware of Grant. He's a big wheel in the low carb world. And I know Grant very well. He's been on this podcast quite a few times. But remember him showing me a paper of insulin responses and glucose responses to patients eating lentils, right? Which are things that are low GI carbohydrates and have been recommended for years by diabetes educators. And what he showed me in the study was there were people who had normal blood sugar levels and normal insulin levels, and then another group who were insulin resistant. They had diabetes, and the blood sugar responses in those two groups was radically different. The people who had normal metabolism, they had a very slow increase in their blood sugar, and it lasted for a while and then dropped. And that's what GI carbohydrates do if you're metabolically healthy. Yeah. But the people who were insulin resistant, they had a massive spike in their blood sugar, and it persisted for hours, right? Yeah. And so your response to carbohydrates is hugely different. Even low GI carbohydrates can be hugely different, all depending on your insulin sensitivity. And this is the thing, but he showed me how many times, he said, this should be the most cited research paper in the world of diabetes, and it was hardly ever cited. So people just ignore it because they have their own confirmation bias and off they go. But I mean, that's the thing, right? Is a lot of these diets are tested in healthy people, and it's very different when you put them on unhealthy people. And that's where you've got to look at interventions for people who have diabetes and insulin resistance, right?
Yeah, and that's right.
That's where the low carb comes up. Now, you seem to be less of a proponent of a ketogenic diet, and particularly around the saturated fats. So talk us through what you're talking about with healthy fats.
Yeah, so I try to encourage patients to prioritize their protein first and then add healthy fat. So when I say healthy fat, I mean things like avocado, nuts and seeds, olive oil, even dairy. In some people that can tolerate dairy, they're good. And even the fat around the meat, it's not just saturated fat. There's a combination of all fats in fat around the meat as well.
Yeah, people don't realize this, do they? That meat has got just the label that all the fat is saturated fat. And particularly if it's grass-fed meat, you look at the fatty acid composition. There's a bit of saturated fat, but there's monounsaturated fats in there, and there's even omega-3 fatty acids in grass-fed meat as well. So it's not that all the fat on meat is saturated. People think that, and
Yes,
nothing could be further from the truth, right?
that's right. Yeah. So the meat has been wrongly demonized for lots of other reasons, but I think we really should think about eating healthy meat. And when I say meat, it includes chicken and fish and pork, lamb, and eggs as well. Animal food really should be prioritized for the reason of good protein, healthy fat, and there are lots of other nutrients as well, like B12 and zinc, vitamin D, which is included in animal food as well.
Yeah. And Abby, you just basically described my diet for the last probably decade. And the reason that I don't have a ketogenic diet, and I don't react particularly well to it, but I
Yeah,
do much better on a high protein, low carb diet with moderate amounts of fat. And I eat plenty of meat, I eat plenty of fish, I eat dairy because I'm fine with it. I'm fine with yogurt and those sorts of things. But
yep,
I think protein is really, really important. And particularly as we age, I mean, my listeners will have heard me banging on about the importance of protein, especially as we age. But yeah, those monounsaturated fats, avocado, extra virgin olive oil, nuts and seeds, like I have oodles of that stuff because I don't
yep,
think anybody would quibble about the health benefits of both monounsaturated fats and omega-3 fats.
yep.
The fat wars are the omega-6 and the saturated fats. That's where we get into the fat wars, isn't it?
Yeah, so the omega-6 is in the vegetable oil, canola oil, sunflower oil. They're highly high in omega-6. They're highly inflammatory. And there's some studies showing that they are the culprit of increasing risk of heart disease and inflammation in your body. So you
Yeah.
really should stay away from that.
Yeah, and again, lots of controversy in it. I definitely side in your camp on that one. And I think what a lot of people don't realize, I mean, let's take a couple of steps back. The reason why these oils were promoted goes way back to 1977 and the heart health hypothesis, right? That saturated fat was bad because it causes heart
Yeah,
disease. And we know that those studies were pretty flawed at the time.
yeah,
So they started creating these alternatives that were byproducts from industries that already existed, like all of those seeds that were created, and then they created those seed oils. Again, if I was czar of the universe, I would have people go in and see how they're actually produced
yeah,
because there's high amounts of heat and chemicals that are used in the production of these oils.
yeah.
And they're promoted because they have a high smoke point. And I think this is really important for our listeners to understand. That means they don't, or it has to be very high temperature before they turn into a trans fat. And everybody knows trans fats are not good. And that's why they're promoted. But an omega-6 fat is unstable. And so as soon
Correct.
as it's heated, it gives off toxic aldehydes, which are highly inflammatory and carcinogenic, right? And so by the time you just get it in the bottle, it
Yeah,
has already been heat treated and had all sorts of chemical shitstorm in there already, right?
absolutely. Yeah, they're actually processed food. So I've heard you saying concentrate on low human
You
influence food. Yes,
low human interference, and
that's right.
you know, if you were to able to see avocado oil, extra virgin avocado oil and extra virgin olive oil made versus how these oils are made, I think people would just stop buying them straight away.
That's right.
So talk to me about the results that you have seen in your patients.
Yeah, yeah. So since I've branded myself in my low carb clinic, the patients come in and they're ready to do low carb already because they're paying me $300 for a consultation. They're paying me money, they invested it, they've invested the time. We spend 45 minutes talking about how to do low carb, and results are fantastic. There's people that reverse their diabetes. Quite often they come in and they're newly diagnosed diabetes, the HbA1c could be 7. And 3 months later, I test it again and it quite often goes right down to 5.7,
Wow.
5.9.
Wow.
And they lose weight, not quickly, but they do lose weight. Men might lose 10 kilo over 3 months, and the women maybe a few kilos over a few months. I've had ladies who lose 10, 20 kilos over 6 to 12 months, and they feel much better. They less bloated. They feel more energy. Their mental health much better. And it's so rewarding that they actually improve in their health. They function better in themselves. It's just that it's difficult in a high carb world to keep going. And sometimes there's stress, sometimes there's going out and holidays. So it's just they need some more support, and they need to, if they go off track, they need to get back on track. It can be difficult at some times.
Yeah, it is. And particularly if you're used to a lifetime of eating carbohydrates, it's a tough diet. So adherence is really key. So I want to tell you a little personal story here. We've got a shocking family history of diabetes, and the genetics, my genetics and my two brothers' genetics around obesity and diabetes are shitters, really shitters, right? And my mum has had diabetes for decades, and I've tried several times over the years to sort of help her, but about a decade ago, my mum and dad came over, and I had been conspiring with my dad. They were coming over for
Okay.
three months, and I went and got them from the airport, and I said to my mum, "Welcome to Camp Taylor."
Yeah.
And we sat down and had a long conversation about diabetes, the long-term implications, particularly neurodegenerative diseases, which scares the shit out of my mother. And I said, "Will you do 3 months?" And she said, "Okay, yes, I'll do 3 months."
Yeah.
And so we put her on a high protein, moderate fat, but healthy fat, just like you were talking about,
Yeah.
very low carbohydrate diet. And she left 3 months later, 20 kilos lighter,
Wow. That's amazing.
and off her diabetes medication and
Great.
off her blood pressure medication.
Fantastic.
And that was in 3 months, 20 kilos, right?
Wow.
And
Wow.
and the weight just dropped off her because she was so insulin resistant, right?
Wow.
But
Wow.
that's with 100% adherence, right?
Yes.
And there
Yes.
was exercise added in and then increased over time.
Yep.
And that's the thing. If you can control somebody in a metabolic ward like that for three
Yep.
months, the results would be even better than free
Yes.
living. Because as you say, it's hard. And
It's
I
hard.
mean,
Yes.
I know it's hard. I tend to eat that, but I'll every now and then have those other things, and it's really hard to be really, really strict, isn't it?
Yeah. Yeah. You touched on something that about getting off medication, which is a passion of mine. And since doing this, I've been taking patients off medication, diabetic patients, taking them off some sulfonylureas, and that is a very rewarding practice of mine. That it's much more rewarding than seeing all patients' coughs and colds. And patients feels fantastic about. I'm telling them you don't need to take this anymore. We're going to reduce your blood pressure tablet. We're going to reduce your diabetes drugs, and that is one of the best things as a doctor.
Yeah, but really rewarding. Now, I want to get your thoughts. Sorry, I know we're coming close to time. I want to get your thoughts on this new class of drugs, the Ozempic, and then the variations of it,
Yes.
which and there's particularly one that's targeted towards diabetes. Um, your thoughts on them, both short term and long term.
Yeah, yeah. So these drugs have been quite controversial. And I think there is a place in them, in those people who are diabetic, and if they want to lose weight, there is a place that these drugs do help them lose their weight, control their diabetes, control their blood glucose, control their diet and appetite. However, I think patients needs to be warned there's lots of potential side effects with these drugs, that they do help you lose weight, they help you lose fat, but they also not help, but they also causes a loss in lean body mass,
Yeah,
including their muscle and bones. And
huge, right?
that's right. And then when you put your weight back on, you'll be putting on fat. So you'll be replacing your bones and muscles with fat when you put weight on. So these people can get more frail, they can more chances of sarcopenia, which is losing muscles. They're more frail, they can break bones. And then there's mental health complications that can come with these drugs as well. And there's lots of potential side effects that we don't know of. So I think there is a place, but patients have to be warned that we don't know what we don't know. So, yes. So I'm not a big fan of them.
I think you summed it up beautifully, Avi. My real concern is the sarcopenia. I did a podcast quite recently on sarcopenia. You know that now 1 in 10 youths are being diagnosed with sarcopenia, and
Wow.
because they're not testing widespread, it's probably much higher than that with all their
Yeah.
sedentary behavior. Now let's take the case of this youth who then has developed sarcopenia, and because they're not exercising, they're sitting indoors all day, they're eating a shit diet, and then they put on weight, and then they go on these drugs.
Yeah.
And then what's going to happen is exactly as you said, they're going to lose more muscle, they're going to lose more bone, which is osteopenia. And then they can't be on those drugs from 20 to 80. They can't be on drugs for 60 years. So they have to come off those drugs. And then, as you say, they're going to put on more fat. They're not going to put on the muscle again. And then they're going to be proportional. And then it's a metabolic disaster. And then what? They're back on the drugs again.
Yes.
And as you say, we do not know the long-term issues. I mean, for the pharmaceutical industry, these drugs are amazing because A, they have an impact on people who can't or won't do the work, right? So that, and there's instant impact.
Yeah.
But B, when they get off, everything goes back. So they need to really stay on the drugs long term. So great for the pharmaceutical industry, but I share your concern. We do not know what we do not know yet. And I think 10 years from now, there's going to be a very different conversation about these drugs.
Yes.
Last thing I want to talk about, you, like me, have recently got into breath work. Talk to me about that. Why have you got into it? And talk to me about your experience with it.
Yeah. I've gone into it for the last year or so, and that's helping me and my patients with mental health and reducing anxiety, reducing stress. And I've dug into it more and more, and I've actually certified myself as a breathwork facilitator. So I branded a new business called Breathe in Health to help patients with improving their breathing, talking about the nose breathing as opposed to mouth breathing, and suggesting them to nose breathe at night and even exercise as well, and talking to them about slowing down their breathing, improving their oxygen in their body because of increasing the tolerance of carbon dioxide. So I know we haven't got much time, but there's a whole lot more science to breathing by retraining your body to tolerate carbon dioxide. And that in turn improves oxygen delivery and quite often calms you down and improve brain health and improve exercise tolerance as well. So I've totally delved myself into this breathwork journey, and I myself feel more calmer. I'll be religious doing breathwork at least once a day, usually 15 minutes. Yesterday I went to a breathwork class and did it for an hour. And I feel much better. My life is super busy, just on the go, and 2 teenage boys drive around. And I feel like I'm managing much better in my busy world.
I too am a massive fan of breathwork, and I think we've done the same oxygen advantage.
Yes, I did oxygen advantage.
Yeah,
yes.
Brilliant stuff. Absolutely brilliant stuff. I'll put a link in for people. Now, talking about links, where can people go, Avi, if they want to find more about you, either the low carb clinic or the Breathe in Health? And I love that name, by the way, Breathe in Health.
Yeah.
So just give us all the places that people can go to.
Sure. My website is Melbourne Low Carb Clinic. It's www.mlcclinic.com.au. And the Breathe in Health website is www.breatheinhealth.com.au. And I'm very active on social media. My handles are Dr. Charlton Lifestyle GP on Facebook and Instagram. My YouTube is Dr. Charlton Lifestyle GP as well. And LinkedIn is just my name, Avi Charlton. And yeah, I advocate prescribing lifestyle. And I've got a podcast called Prescribing Lifestyle, which you've come on. And I talk to many people who have improved their health or with lifestyle and other lifestyle practitioners. And I'm really big on not prescribing medications and de-prescribing medications to my patients.
Amen. We need more GPs like you, Avi. Keep doing your awesome work, and thank you for returning the favor and coming on my podcast. I think it'll be awesome for the listeners. And if you have metabolic syndrome, or you're there, you've fat around the middle, your high blood pressure's high, your triglycerides are high, your HDL's low, your glucose is high, or any three of those, get on the Avi Charlton bandwagon, because it's not a slippery slope, it's a vortex. And once you have metabolic syndrome, so early intervention is critical, isn't it?
Yes, absolutely. That's right. We can reverse all of that
Yeah,
by healthy diet.
But the earlier you start, the easier it is to reverse it. Thanks, Avi.
Thank
awesome
you, Paul. Thanks for having me.
Cheers.